My name is Maddie Diltz, and I'm going to be talking to you about alcoholism. Have you ever thought, is alcoholism real? Can an alcoholic really have a disease? First, I just want to discuss what an alcoholic is. An alcoholic is a person who drinks, has problems from drinking, but goes on drinking anyway. Let's explain why I use the word disease. The point of using the term disease is simply to underscore that once an individual has lost the capacity consistently to control how much and how often he drinks, then continued use of alcohol can be both a necessary and a sufficient cause of the syndrome that we label alcoholism, from the Natural History of Alcoholism Revisited. Population surveys show that 62% of adults in USA drink, 11% of men, and 3% of women. Alcoholism, the facts. Now that we've established what alcoholism is, or now that we discuss some information, let's move on to what alcoholism is. Alcoholism is a chronic and often progressive disease that includes problems controlling drinking, being preoccupied with alcohol, continuing to use alcohol even when it causes problems, having to drink more to get the same effect of physical dependence, or having withdrawal symptoms when you rapidly decrease or stop drinking. MayoClinic.com. Alcoholism runs in families. Children of alcoholics become alcoholic 4 times more than children of non-alcoholics. Alcoholism, the facts. Alcoholism commonly coexists with other psychiatric problems, and like alcoholism, psychiatric problems tend to run in families of alcoholics. Alcoholism, the facts. As for psychosocial factors, presumably people drink for reasons, and the reasons may be psychological, a wish to feel happy, or social, a wish to feel less shy in groups. And binge drinking, which often occurs with teenagers and young adults, may lead to faster development of alcoholism, from MayoClinic.com. Now that you know what alcoholism is, let's discuss complications. There are quite a few complications that come from drinking too much. Alcohol depresses your central nervous system. In some people, the initial reaction may be stimulation, but as you continue to drink, it sedates you. But as alcohol lowers your inhibitions, affects your thoughts, emotions, and judgment. MayoClinic.com. Excessive drinking can cause erectile dysfunction in men, and in women it can interrupt menstruation. MayoClinic.com. Long-term excessive alcohol use has been linked to a higher risk of many cancers, including mouth, throat, liver, colon, and even breast cancer. While these are some complications, let's learn about some symptoms. If you are wondering if you may know someone that has alcoholism or are just curious about the symptoms, here are just a few. Not remembering conversations or commitments, sometimes referred to as a blackout. Keep alcohol in unlikely places at home, at work, or even in your car. And make a ritual of having drinks at certain times and become annoyed when the ritual is disturbed or questioned. Along with alcoholism is some complications and symptoms. Here are a few treatments. There is not one single approach to the treatment of alcoholism that is proven to be effective. Alcoholism, the facts. Someone can recover on their own without any help, and that is called a spontaneous remission. Spontaneous meaning that remission cannot be explained. Depending on the circumstances, treatment may involve a brief intervention, individual or group counseling, an outpatient program, or a residential inpatient stay. MayoClinic.com. Treatment of alcoholism may begin with a program of detoxification, which generally takes 2 to 7 days. MayoClinic.com. A drug called disulfiram, also known as antabuse, may help to prevent you from drinking. Although it won't cure alcoholism or remove the compulsion to drink, if you drink alcohol, the drug produces a physical reaction that may include flushing, nausea, vomiting, and headaches. MayoClinic.com. Now just remember, population surveys show that about 62% of adults in USA drink. 11% of men and 3% are women. That's from Alcoholism, the Facts. And we learn how easy it is to get carried away with alcohol and what a possible outcome could be from drinking too much. We all know that there is no right answer or wrong answer on what alcoholism is or even a treatment. So after learning all of what causes alcoholism and how common it can be, think before you drink. Any questions? Yes.
If you have one drink a day, is that an alcoholic?
It's not considered alcoholism, it's an excessive, but over time it still can have effects on you that alcoholism drinking, like binge drinking, can. Anything else?
No.
Okay. I'll pee.